May I now request and invite the Honorable Minister to officially launch and announce the India IPV program, and may I also request him for his keynote address. Ladies and gentlemen, Shri J.P. Nadda.
My esteemed colleague, Minister for State for Health and Family Welfare, Shri Shripad Yesu Naik ji, Secretary Health, Government of India, Shri B.P. Sharma ji, DGHS, Dr. Jagdish Prasad ji, Regional Director, WHO, Southeastern Asian Region, Madam Poonam Khetrapal ji, Additional Secretary Health and Family Welfare, Shri C.K. Mishra ji, Mr. Sabu, my esteemed friend and a Rotarian, Louis Astronaut, representing UNICEF to Government of India, Michael McGovern, a distinguished Rotarian who is here on the dais, Rakesh Sinha ji, Joint Secretary, Ministry of Health and Family Welfare, senior officials from the Ministry of Health and Family Welfare, distinguished Rotarians, members of the developing partners, distinguished guests, and my friends from media, electronic media and print media. It is indeed a matter of great happiness for me to be the part of this historic event in the field of child welfare and the child health. When we are going to launch IPV, it's really a giant leap which the health department, along with all your support, is taking in the field of child health. It is an opportunity for me to be a part of this program, and it is also an opportunity to witness how India with OPV starts with IPV also. We all know that India has done well in eradicating polio from the country and from the region also. A lot of efforts have been done in the past 1 decade, more than 1 decade. And of course, the last case witnessed was in 2011. And it was in 2014 that India got the certification of polio-free, the monumental achievement which India could gain and which India could have. And we should feel proud of it, and it has been done with all your effort, with this effort of all developing partners, all support of the society, every sections of the society. And I must thank all the developing partners and my friends who worked for day in and day out to achieve this monumental achievement. But at the same time, as we say, the risk is there, because we all know that the virus is still active in Pakistan and in Afghanistan. Our Honorable Prime Minister has said that we are there to support Pakistan and Afghanistan as far as the technical support is concerned, as far as the sharing of the experiences is concerned, as far as the support of vaccines are concerned. We are all there to take care. And we have started this job in Afghanistan also. But at the same time, we have to be very vigilant here in our own country. We have been declared as polio virus eradicated, but still the risk factor is very much there. And for that, if we do not get the reinfection, and so we have to be very vigilant till the polio virus is not eradicated globally. And for that, we have to be vigilant. We have to see to it that how do we work, how do we strategize ourselves. And this launching of IPV is a step forward in that very direction. We want to protect our children. We want to give them a double protection, as earlier speakers all have said, that we will continue with OPV. And at the same time, in April 2016, we want to develop that end game strategy, and switch over to IPV also, and to switch over from trivalent to bivalent. So this is a task which we have to do, and we have to be very focused. I understand my responsibility. We have got a short span of only 5 months, and we have 5 months, and we have to see to it that the department, along with all our support, moves forward and sees that we go for a successful switchover. And for that, the ministry is toiling. I must congratulate my officers and all of you, developing partners, Rotarians, WHO, UNICEF, Gates Foundation, all have been doing good work. So we all together have to work and see to it that we develop this strategy and go forward. As told that we will start in Assam, in Gujarat, in Punjab, in Bihar, Madhya Pradesh, and Uttar Pradesh, 6 states. But in 2016, April, we have to launch it countrywide. And for that also, we have to see to it that the support system, the cold chain system, the other systems should work accordingly. So we are very vigilant and must assure that the government of India is focused on that, and we will be going forward in that direction. And with this, we will have our children protected, which we call as a double protection. So we will strengthen the child health care also, but at the same time see to it that the virus we do not get reinfection, and also see to it that our neighbors, whatever support they need, we will give them so that they are able to fight this virus, and see to it that that the world becomes globally eradicated, polio virus eradicated. That is what we have to work. Friends, our Prime Minister is very clear, and he has given a very clear mandate to us, that see to it that every preventable death of a child has to be prevented. We cannot afford to lose a life of a child when we can prevent it. And that is why we are trying to see to it, strengthen our routine immunization program. We are trying to see to it, develop a robust system in the states, in the far-flung areas, to see to it that we have a very robust cold chain system, and our routine immunization should be strengthened. But at the same time, we know that approximately 26 million, 2 crore 60 lakh children are born every year. We are very proud to say that India has got the world's largest public health program of routine immunization. People cannot imagine. The other countries cannot imagine also. And that is why I always say, India cannot be compared with any country. See the size, see the geographical far-flung areas, see the demographic situation, see the federal structure, see the government having a federal structure with a democratic system, and still working and seeing to it that in the far-flung area, we are able to reach the last child who is there. We all know our responsibility that approximately 2 crore 60 lakh children are vaccinated, out of which 90 lakh children are either partially immunized or totally unimmunized. 20 lakh are totally unimmunized, and 70 lakhs are who are partially immunized. That is why I took that very ambitious program called as Indradhanush. We want to reach the last child. Apart from the routine immunization, we took this program in the month of April. I am happy to share with friends that we had a very successful first phase, and approximately 75 lakh children got the vaccination. 20 lakh children got totally unimmunized. We are now going with the second phase. The results will be coming in the month of January, but certainly we'll be trying to take a leap in it and see to it that children get totally immunized, and see to it that the vaccination is done and total immunization takes place. That is what we have to work. It needs all your support. It needs the support of the society. We have been able to reduce the IMR from 58 per 1,000 live births to 40 per 1,000 live births. The reduction has been 4.5%. We are not very satisfied with it. We have to go further. And I think that after this immunization programs, the targets are going, the results are going to be better, and we'll be having a better result in this direction. Friends, we have developed many strategies. safe deliveries of child in the institution, which we call as institutional delivery. We have been working for Janni Suraksha Karyakram. We have been working for the child's safety. We have also developed the life cycle strategy to see to it that the child gets all types of supplementation and supplements whenever and at whatever time it's needed. The life cycle approach is that the child, when he takes birth, or the child when takes birth, till he or she becomes adolescent, we take care of the supplementation which is needed. So Health and Family Welfare, with all your support, is trying its best. It could not have been possible without your active support, without the support of WHO, who has been a guide to us, who has been always giving us support. It could not have been possible without the Rotary International. It could not have been possible without the active support of UNICEF. It could not have been possible without the active support of the state governments. I really thank all of them. And I feel, as Madam Poonam Ketrapal had said, that the cooperation is very much needed. Certainly, with the cooperation of development partners, we have to go ahead, and with all your support, we'll see to it. And today, being a historic day, that when we launch IPV, we also see to it that we make our children doubly secure from polio virus, doubly protected from polio virus. So it's a giant leap in the child health care system, and I think we all should feel proud to be a part of it. We all should feel proud to witness this event and see to it that in coming times we make it a real success. Thank you very much. I officially announce the introduction of IPV in routine immunization schedule in India, beginning with 6 states: Assam, Madhya Pradesh, Uttar Pradesh, Bihar, Punjab, and Gujarat. Thank you very much.